Frontal view of the patient, and you can see the tremendous width of the upper and middle third of his nose. And this is where he took the brunt of his injury. So what I typically do is we'll mark this area with the marking pen, and this will just indicate, in my mind, where the major portions of his deformity are located. He has some bulbosity in this area. This would indicate to me that he has some cephalic positioning of his lateral crura. They're probably moving up in this direction on both sides. Again, his nasal tip in the lobular area looks pretty good. He does have some nostril asymmetry. So initially what we're going to do is perform some injections of the local anesthetic. So the first thing I'll do is inject a little bit along the side wall of his nose. So I'm going to take this local anesthetic and I'm going to inject it just along the side wall in the area where we would perform his lateral osteotomies. I'll also inject along the internal surface of the nasal bones. I'll demonstrate this again at a later point in the operation. Now I can feel with the needle here that his bone in that area is very dense and very thick and probably scarred. Next injection we'll place is right down the region of the columella between the medial crura. And then we'll also place an injection up along the dorsum of the nose in the area that we'll do our dorsal dissection. And then we'll place an injection along the base Okay, so now we're going to inject the marginal incisions. You can see this area here is where the injection is going to be deposited. This is the caudal aspect of the cartilage there, so I'm going to place a little bit of a local anesthetic right into that area, right along the positioning of my marginal incision. I'm going to do this all the way around. Deposit a little bit right over the medial crus. Similar injection on the opposite side, right where we're placing our incision just along the caudal aspect of the lateral crus. Just multiple deposits of local anesthetic. Okay, so now we're going to perform an endoscopic examination. We're going into the right nasal airway. You can see that there's a scar located in the region of the right internal nasal valve. As we move posteriorly, you can see some scarring along the floor of the nose, but otherwise the airway looks reasonable. Looks like there's been some previous work on the inferior turbinate. We move into the left airway. You can see some degree of internal recurvature of the left lateral crus right there, that little bulge in the side wall. And as we move intranasally, you can see a high septal deviation blocking the left internal nasal valve. So there's a high septal deviation moving all the way back, which is creating some blockage of the upper aspect of his airway. The inferior aspect of the airway looks reasonable, and then he has a posterior bony deflection as well. So this upper aspect deviation is likely due to his injury. And then if you look caudally here, he also has a caudal septal deviation, which is also impinging in the region of the nasal valve. We've already injected the nose, and we're going to begin by making a mid-columellar incision. So I'm going to mark the incision out here at the level of the mid-columella. Sometimes we alter the position of this incision based on what we're trying to accomplish. In this situation, we're going to try to increase this projection. So I just place it in the region of the mid-columellar level. Can I have an 11 blade, please? We'll begin by making an incision using an 11 blade. I use a sawing motion to execute the incision. Taking care to avoid damaging the medial crura as I move laterally. Two-prong. and a 15 blade. Now we're going to make the marginal incision. So the marginal incision we make right along the caudal aspect of the lateral crus. I'm using this blade and I can feel the lateral crus right there. So we're going to go ahead and make the incision right along the caudal aspect of that lateral crus. I'm going to do the same thing on the contralateral side. Again, this is the lateral crus, the edge, you can feel it with your tip of your 15 blade. Now we'll just complete that incision. Now we'll make the marginal columellar extension of the marginal incision. That's going to go right down here. And then the same thing on the contralateral side. Now we're going to raise the flap carefully here because this is where the medial crus sits right underneath that skin. Sometimes that skin there is very thin. And if you're not careful, you can damage the underlying medial crus. Two-prong.